Okay, so we're looking at the skill of venipuncture, and this is something that you would need to undertake the theoretical content before you actually undertake the skill. There's some content there that you should be made aware of, and we're not going to go into the details during this video. So venipuncture, we're assuming I've gained consent from my patient, explained what it is that I'm going to be doing. I will have got my equipment together and checked all the expiry dates and that it's all intact. Include checking the dates on blood bottles. That's something that quite regularly gets forgotten about. So I'm happy I've got all my equipment. Before I approach my patient, decontaminate hands. Okay, so I'm now ready to inspect the veins. There are disposable tourniquets that should be used. So the tourniquet should be applied a few centimetres above where you want to get access to the vein. The tourniquet should be of sufficient tightness to help dilate the veins but not to cut off the circulation. So 2 fingers underneath whilst you're tightening it will help. You should be able to feel the pulse, the radial pulse with the tourniquet on. Okay, so now I can palpate and try and find a nice bouncy vein where I can access some blood. So on the mannequins it's quite straightforward to find. There are some electronic equipment that will show up veins, so you can actually see the lie of veins in people's arms, so that's quite useful. Okay, so once I've located where I'm going to go, the tourniquet should come off again. Tourniquet shouldn't be on for any longer than 1 minute because that can affect the blood results. So there can be hemolysis of the blood and things like potassium. You can get false results or they won't give you a result. So we don't want that on for too long. I know where I'm going to go, so I'm going to use my chlorhexidine and alcohol wipe and up and down and side to side for 30 seconds. So once that's done, we'll wait for 30 seconds. This is important because we don't want to introduce the chlorhexidine and alcohol into the blood system, and it will also sting and be uncomfortable for the patient. So 30 seconds has passed and that area would be dry. I'm now going to get my equipment again, make sure that we're good to go, and decontaminate my hands again. Right, so I'm now in a position to put my gloves on. It doesn't have to be sterile gloves, but if you have a patient with very difficult veins, you could use a sterile glove. We don't want to be repalpating where we've cleaned, but if, as I say, the patient's got difficult veins to view, there is an exception and you can use a sterile glove to repalpate. Make sure that your gloves are a good fit and they're not so tight that your fingers are bursting through or constricting your blood flow, and that you don't get any flippy floppy bits at the end. So you've got good dexterity. So tourniquet can now go back on. And using a safety needle with the bevel uppermost, so we have a bevel, so the open area as opposed to the closed area, so the bevel area would be uppermost. Anchor the vein below where the needle's going in. You don't want to be anchoring the vein above and potentially stabbing yourself. So at a 30-degree angle, puncture through the vein, and because we've got a flashback needle, you can see a flashback of blood instantly telling me that I'm into the vein. Advance just a little bit further without puncturing through the other side of the vein, and at this point you can take the tourniquet off and then apply the bottles in the correct order. So use the shoulders of the vacutainer and your thumb to push without pushing the needle further into the vein. And as you can see, because they're vacuumed, it will fill the bottle. When it looks like the filling has subsided, take that off You can see I'm anchoring this vacutainer hub to the person's arm so it's not moving backwards and forwards. And again, fingers either side of the shoulders, pushing in with my thumb and filling up the bottle nicely. Okay, when you've got all the blood that you want, we would then need to use a swab, lint-free swab, and take out, it wouldn't be the one that you've used to clean the vein, just a lint-free swab. Slide out the needle and then apply pressure to the puncture site. Don't apply pressure and slide the needle out, otherwise that will be painful. You can then resheath safely, because it's a safety needle, thumb or onto a table, and then that will go straight into the sharps bin. The patient could apply pressure using the swab, or you can hold pressure. What you shouldn't advise is for the patient to bend their arm. That will just encourage a larger amount of bruising. And then with your blood bottles, just invert them a few times. Don't shake them up. Invert them a few times. Make sure you label them correctly at the patient's bedside, and don't move away with the bottles, because there's a risk of blood getting mixed up with other patients' blood. And then clear away the area, remove your gloves and apron, and decontaminate your hands. And you're done. Just a reminder that the order of draw is really important. So there's a nice little reminder here of the order that that should come in. So we've got a nice picture of blood cultures being the first thing that we take off. And then we've got light blue for the sky, then the red for the sunset, going into the gold glow of the sun, with the green trees, the fields of lavender and the pink flowers. And then lower down in the earth, we've got the stone, or as we're getting to the beach even, we've got the gravelly beach, and then the blue, darker blue sea. So it's a nice little way of trying to remember the order that you should draw the blood from.